If you want to get the cost down of healthcare, it seems like fraud would be a good place to start. And of course, fraud is part and parcel of every government program, well, every private program as well, but particularly Medicaid and Medicare has been for years. And by fraud, I'm also including abuse and waste. Fraud is where you outright lie to someone. You bill for a piece of equipment you never ordered, or you could, abuse is, let's say you've got a test and you automatically redo the test if it doesn't come in within specific parameters, even though the doctor never told you to. Or you could just have outright sloppiness where the doctor's office doesn't code something appropriately. Of course, that may or may not be sloppiness. I mean, there's a tremendous amount of bureaucracy with Medicaid and Medicare. But there are two things that are really stunning about fraud when it comes to Medicaid and Medicare. And the first is that the government doesn't really call it fraud. They call it payments in error. Well, according to their own numbers, Health and Human Services, there were $10 billion in payments in error in 2007 for Medicare, and Medicaid was $32 billion. If you talk to congressmen, or there's also an organization called the National Healthcare Anti-Fraud Association, they calculate it more in the neighborhood of $60 billion a year in fraud, waste, and abuse. The second thing that's kind of a stunner about Medicare and Medicaid fraud is the amount of money they spend going after it, which is almost nothing. If you calculate it as a percentage of how much they spend on healthcare, the percentage is less than 1%, significantly less than 1%. And keep in mind, I mean, there's some low-hanging fruit there. One task force arrested, I think, 56 people who were fraudulently billing $250 million just for a 3-month period. So my attitude is, if the government isn't going to keep its own house clean, I want nothing to do with a single-payer system, and I want nothing to do with a public option for health care.